Julie Hershberg, we have arrived. How are you?
I'm doing pretty good, Mike. How are you?
I'm doing great. So, welcome. You are the second person to be on Tuesdays with Mike, as we're calling it. And obviously, this is the Julie Hershberg episode. So, this is all about you and everything that you want to talk about. First off, let's just set the record straight here because you'll recall better than I. Give me your best estimate. How long have we known each other?
Oh my gosh, Mike. Before I had kids, so we met putting together a course for the neuro, it was then called the neuro section, right?
Yep.
The now the academy.
Right.
And when we first presented that course, my now high school senior was firmly in my belly. So that was, but we spent a lot of time on that course putting it together, probably a
We did.
year. So
Yeah.
maybe that was 18 years ago, Mike.
Somewhere in there. So, somewhere in the 2007 range before many things have happened in the world, even before
Yeah,
there was such a place as reactive, right?
true.
All right.
Yeah,
Now, I've got
yeah.
some heavy hitting questions today that we've talked a little bit about, but one more light question as we get started here. Help me understand reactive. It's so innovative. You've got the plus sign in there. Perhaps even the meaning for that has evolved some over the last, call it 15 years or so. Tell me, actually, and it should be 15 years, right? You just celebrated a 15, well, you just celebrated moving into a new location. But talk to me
Yes.
about all the things. What to you does reactive mean with the plus sign in there?
Yeah, yeah. I laugh because when I started my business, I was Hershberg PT, and I
Okay.
hated that, Mike. I
Okay.
really did. I was like, this isn't about me. This isn't about my name. It's about the people that I work
Yeah.
with. And I've been, doing that for about a year or two, which was indeed 15 years ago.
Okay.
And my I was obsessed with this idea of like people recovering and recovering through their activities. This was
Hmm.
the so it was recover
Yeah.
activity. And I also really wanted a plus sign, Mike. I can't even like tell you why I wanted a plus sign.
Okay.
And I think I got to tell you, I think there's a big part of that that felt like as a neuro rehab clinician,
Yes.
so many of my patients were given minuses. Well, you like if you ever did a Dr. Perry gait analysis, which by the way, she was my very first patient, Mike. I don't know if you knew that.
I did
Dr.
not. I
Perry
knew
was my
you've
patient.
had some very famous neuro rehab patients, but I
I
did not know
have.
she was your very first. Okay.
He was. So if you ever did a Dr. Perry gait analysis, you would say things like inadequate dorsiflexion and inadequate this. Our patients were given so many minuses.
Yeah.
And I really like felt this strong pull to like, let's bring in people's strengths. This is like
Yeah.
the plus, this is the power of the plus to me.
Oh my
And
gosh.
I'm an optimist too. So
Yeah.
and it's probably why I was obsessed with it.
Yeah.
Um, but that's really the story.
And the second part of that is you feel like I guess consistent with my assumption that the meaning of the entirety, including the plus sign, has evolved over a period of time. What does it mean to you now?
Yeah. Well, I mean, I think first of all, it's reactive physical therapy and wellness,
Mhm.
and it was
Yeah.
just me. And
Yeah.
I did have an idea of me, and I would do some classes for folks.
Hmm.
And that boy has really evolved beyond my wildest imagination to be an entire integrated
Yeah.
team. And honestly, that wasn't my vision from day one. I was just trying to help patients. I didn't have a
Right.
grand scheme of things.
Yeah.
And so it has really evolved to for me to be actually much more than activity, right? Like much
Yeah.
more like, let's look at a person's entire life
Yeah.
and what they may want to accomplish, or what's possible for them
Yeah.
when they're getting some support for their brain and body. So that certainly has evolved. I wouldn't have even dreamed that up on day one.
So now it's great that you had the plus sign because it gets to encompass all the things that were not initially envisioned. That's great.
That's true.
Plus,
That's true.
plus all the things. All right. So Julie, you know how much autonomy is important to me, and I believe to both of us. Here comes, you've got two questions that we initially bantered about. And I'm going to let you actually pick which one you would like to answer first, and you can easily flow into the second. But paraphrase to some degree, I believe these are the most compelling questions of our episode today. What is it that still excites you about rehabilitation, all things rehab, neuro rehab, etc., wellness, etc.? What still excites you? And the second question you get to choose which to answer first is, what are things that we used to do, used to think we know, had laid with some degree of certainty about, had solidified or concentrated that we actually now don't believe? Choose which one you would like to answer first, or invent your own question behind door number 3.
I know. I think I want to plus sign those questions
You can
together
do
and
that.
bring them together. Well, particularly, I hadn't even thought about this, Mike. I think I want to start with question number 1, but in
Okay.
question number 2, you actually had the word believe. And I think that actually is what excites me in question number 1. I mean, first of
Mhm.
all, I'm very excitable about all things rehab. So, like, this is a very hard question, but you know what like, I'm going to say what it excites me this week is something that one of my patients shared today. It's CRPS like Awareness Month, and she's sharing a lot of her reflections. She's had quite the journey, and she shared a reflection today about being believed. And
Okay.
I think it's going to choke me up a little bit, because how much that shifted her journey when she had been to doctor after doctor that said there's nothing wrong with you, despite all the positive telltale signs that she had CRPS.
Mm,
Just she didn't come into contact with somebody that really knew and understood it. And
mm.
when she did, her journey shifted to one of being uncertain about her whole self. Like, am I crazy? Am I making things up?
Right.
To, oh, somebody believes in me and are going to help me even take one tiny step. And I wasn't the person that believed her. I mean, I've been a believer on her journey, but
Sure.
she
Sure.
she met a doctor who gave her a diagnosis and believed her. And that power, and I think in the literature or things that call it also part of the therapeutic relationship or therapeutic
Mm,
alliance. um I think we've underestimated it, and quite frankly, a lot of the literature is kind of proving that, so of
yeah.
how much interventions um rely on this relationship between
Mhm.
the people, and a give and take relationship, right? It's not just
Yeah.
me, the provider, giving. It's a give and take. It's a two-way street. Um and just how powerful that is. And so let's take this into question 2. I can remember
Yeah.
as a student thinking precisely where my thumb was on the spinous process of C4 was going to make me the god of rehab, right? Like,
Right.
this was the thing.
Yeah.
And and I got to tell you, I'm like kind of uncoordinated. So I actually felt
Yeah.
really, um, really dejected about some of my manual skills, to
Oh
be
my
honest.
gosh. Yeah. Yeah.
And,
You
and
were not, just let me stop you there. You were
yeah,
no worse than me, probably better than me, because I always knew I was the worst manual therapist in our entire class. You continue though.
really, Mike.
Oh, I was terrible. Terrible. I had no belief in my hands. I didn't believe what I was told that I could effect. So
Yes.
I did these appendages. I didn't believe that they had any magical powers to effect a change. And so I never felt the pulsation, the release, and the landmark, etc. So yeah, continue on.
Yeah. Well, doesn't that go back to belief? What
It
you
100% does.
believed about yourself, Mike,
Yes,
actually
yes,
influenced it. I felt the same. I wasn't kind of like, dare I say, and they're my friends, but the bros in my class that were like, cha-ching, and everybody was like, I'm healed, and it felt great. I just felt like that wasn't ever going to be
you,
me. However, along my pathway, I have had patients tell me my hands are magical, and I started believing, right? But actually, what I do believe now is how I tune in, and honestly, Mike, thanks for your mentorship, because how I tune in, how I show up with my patients, how I'm there, how I believe them, how I sit with them with hard
yeah,
things, turns the other things that might happen in that therapeutic relationship
yeah,
on a
yeah.
totally different pathway.
That
Right.
is
And now I'm not
amazing.
saying never learn a manual skill or never learn
Right.
some of these great therapeutic modalities. I'm
Sure.
just saying this to me is is it's the
Yeah.
gold. And it's gold for me as a clinician. Like, it makes what I do so
Yeah.
meaningful.
It's powerful what you're saying, not to become too wax poetic or philosophical about it, but some people can touch with their fingers. Some people can touch with their mouths, and some people can touch with their ears.
Mhm.
Uh,
Yeah.
and I believe that an individual practitioner needs to find what skill they have that is an effector, and use the skill that they are best blessed with or have the greatest belief in. And we don't know really which comes first, right? Do I have
Right.
belief in my power to hear and speak to you? And therefore, I believe that's my strongest power and it becomes my strongest power? Or did I have that ability and then I believed in it secondarily? Who knows? Who knows?
Right, right. And we don't know. And one of the things that I like, I think about this a lot. So yeah, I Mike, my history. I worked on the LEAPS trial, right? With
Yeah.
the largest randomized controlled
Oh
trial
my
in
gosh.
walking recovery
Yeah.
post-stroke. I worked with hundreds of people post-stroke, and I performed both arms of the intervention, a
Yeah.
task-specific high intensity walking training that was
Right.
so fun, and I loved doing it, and a home-based, uh, frankly, slightly
Right.
boring strengthening program. I did both of those.
Which
Now,
we know which turned out well or
which,
better or
right, like, they turned out to be pretty much exactly the same for walking recovery post
yeah.
stroke.
Yeah.
Now, nobody was measuring what aspect of Julie Hershberg was coming to my little group, or, we had these great therapists going into the homes. You know what happens when you go into a patient's home and they're like, yeah, like, I can't reach that thing off the shelf, and maybe when I'm doing this exercise is going to help me get there. They're making these leaps, they're enjoying you in the home, you're connecting with them,
Yeah.
you're believing in them. No one coached us on how to believe in them. We just
Right.
did because we're therapists and we were good neuro rehab therapists. And so, who knows, because we didn't measure that, right? But I learned a lot because I had a strong belief that one of those particular interventions would actually be better.
Right.
And and it actually, it didn't matter, right? And that
Right.
flew in the face of some of my beliefs, but I think it actually took me down this road of like, huh, it made me question things more, right? It
Right.
really did, about what's the right fit for the right person.
Hmm.
And what are some of those, je ne sais quoi, like what unknown pieces that we don't measure well that really tie in to what we do one-on-one with a patient, or even in a group of patients. There's
Yeah.
just so many ways that these little, how we smile at them, like a pat on the shoulder. I know you said you're, maybe you didn't have the skills with my hand, and I feel that still very much. It's not like my biggest tool, but the
Yeah.
co-regulation that might
Yeah.
happen, and a
Yeah.
touch that I might have, or the presence that I bring to that touch, boy, that shift has really that's really fascinated me
Yeah.
for the last couple of years.
Wow. Yeah. So massive there because you really have now encompassed both questions there. This excites me. Belief matters, consideration that I can question everything because all of my most highly esteemed colleagues were also studying this, or even if they weren't involved in the leaps, would also definitely value this is definitely going to be the win. Yet, if I'm wrong about that and they're wrong about that, it's okay for all of us to question everything. And that opens up, possibilities when we do that as well. So that's exceptional and beautiful. And, the other last point that you made there is that sometimes we use our hands to effect a change on the body, but sometimes, as you mentioned, you're using your hands to effect a change on the mind, right?
Mhm.
And it's okay. I'm here. I'm listening to you. I'm with you. So many types of touch that are not intended to change how you move, but are intended to move the individual still, right? To move them on
Yeah,
the psychological level rather than the body system level. Yeah.
right.
Yeah.
Although
Excellent.
might argue that when we move on the psychological level, it
Particularly,
actually
yeah.
it is changing our physiological like
That's exactly
being,
right.
right?
It is
Like
bi-directional for
it's
sure.
bi-directional.
Yeah.
It's so very interconnected. And I think one of the other things that like kind of wraps those belief pieces up is just, again, I think I learned, and I was in school 25 years ago, right? Like that that these were kind of separate. There were
Right.
psychological things or psychiatric things, and there were like body things and neurologic.
Right.
And in fact, like the neurologic was kind of separated from the
Right.
psychiatric. And that's a simple way to learn it. I think it made sense to me, like in a very black and white way. And now I'm just like fully immersed in like, oh my gosh, it's so connected, and the brain networks and how they shift not only in neurologic disorders, but in athletes, in neurodivergent folks, like just
Right.
so much interconnection. I think I am much more at home in the gray now,
Mm.
than
Hmm.
the black and white. I think that's a natural progression as
Right.
a clinician,
Yeah.
from new grad to not so new grad anymore.
Well, and I think what I'm hearing you say there is that something we all acknowledge, back when I was in school, not that much time had passed between our respective schoolings, but it was relatively acknowledged that we had individuals that were inclined toward orthopedics, and that it became somewhat fun to say over the years, oh, hey, don't forget that, your patients have a brain. And now I think we've pivoted so far that it doesn't matter whether you're talking about pain neuroscience or top-down control or mindfulness or cognitive behavioral therapy, et cetera, that I think we all really know that as you just drew out sports, orthopedics, persistent conditions, that the reality is the brain was always there, and now people that are quote orthopedically inclined are now enamored with courses and new techniques that include, if not emphasize, the existence of the brain and the remainder of the nervous system, right? And in the same realm, not to pretend that the neuro geeks always had it right, I think we're garnering a greater impression for the peripheral drivers, though, as well, in terms of
Right.
what the body can do to elicit, stimulate, trigger the brain. And so the interconnectedness, we all meet in the middle, but I think both of us have come a healthier direction in our separate pathways.
Yeah, yeah, for sure. I mean, kind of like one of our logos for Reactive is the no brain, no gain. I'm wearing my
Oh,
sweatshirt
yeah.
today, and it's
Yes,
got the
yes.
little brain with the watering can, watering it. And I think the world as a whole is recognizing that
Yes.
the interconnectedness. I think potentially our Western medical
Mhm.
is I still hear a lot of traumatic experiences
Mhm.
from patients, like I shared at the beginning, of maybe
Right.
not being believed, and that has been a huge shift. I mean, I think you and I both learned conversion disorder, right,
Oh,
in
sure.
school. I even wrote it in a book chapter
Yeah.
on like psychological disorders in PT, right? Like, so
Right.
literally this was something we learned, and over the course of my career I had to unlearn
Yeah.
that
Yeah.
that now known as functional neurologic disorder is indeed not just a conversion of psychological
Right.
trauma into a movement disorder.
Yeah.
Um, but again, that came from lots of studies and lots of great neuroscience informing us that there's other pieces to the puzzle here that we just weren't aware of um,
Yeah. And that
in
does
the
a great
past.
job to start to open up that second question even more. Things that we believed, you even wrote as an authority in a chapter, conversion disorder, that we no longer believe. And remember, that was a healthy advancement from hysteria, right?
Right.
And who knows exactly where psychosomatization came in there around conversion disorder, but no healthier to suggest that what your body's doing is a manufactured element from your dysfunctional psychological componentry. No healthier, right? So, what are other things that you used to believe firmly that you no longer believe now? We've touched on a couple of things. Anything else you'd like to elaborate on there?
Oh gosh, Mike, I feel like there's so many. Um, oh man, I had this thought just driving home the other
Mm-hmm.
day, because you know how certain patients just really stick to you.
Yes.
And in my early days, I worked in the county system, folks
Mm.
that didn't have healthcare insurance, and they had a real like multitude of socio and economic factors that went into their recovery. And I
Right.
was a resident and a new grad. Many of the folks that I saw with spinal cord injury were gunshot wounds. um, we did home visits to places I probably had no business being, and I had no idea. I was very naive. And it was very needed. I'm not saying I shouldn't have done it, but
Right. Right.
I think when I think back then, to understanding the whole societal influence on a
Mhm.
person's healthcare outcome,
Mhm.
I was naive. I didn't understand privilege. I didn't
Yeah,
understand what it meant. I wore my white coat, Mike, everywhere. I wore it to home
sure.
visits in people's homes in South Central. Like, it was the most privileged white girl
Right,
thing you could ever do.
right.
And still, luckily, these people trusted me. Like, I look back and go, I cannot believe these people trust me. These people became my friends. um
Mm.
i I was friends with many gang members and their families because I cared deeply about them, but I definitely did not understand the full impact, the full big
Yeah.
picture, the structural things that folks were up against. And
Wow.
to like, I feel lucky that my care exceeded that, but
Hmm.
I missed things, Mike. I missed
Wow.
opportunities. I might have had judgment, right? And I I I would do it differently, right? I would do it
Yeah.
differently. And it makes me, I was literally thinking of this kid, Darrell became my friend for a long time. I We would
Mm.
show up at wheelchair basketball games and stuff, and this kid maybe had one of the hardest lives growing up that I had ever met.
Yeah.
And I wish I had taken more time to really understand that. I
Hmm.
wish I had recognized some of those things that put me into kind of a position of power,
Yeah.
that could have gotten in the way of care. And
Yeah.
I have many colleagues and friends, especially at the University of Southern California, to thank for like really opening some of my eyes to the social determinants of health that I just really wasn't aware of before.
Julie, I want to give you a space and just honor what you said there. I'm going to tell you, I'm going to end this with a humorous comment, I believe. But I first, before playing the Mike Studer humor card, I just want to give you space and agency to just to be the human being that you are, to state that you would not like to go back and pretend that everything that you did was perfect. I asked you about what you believed in and no longer believe in, and you went immediately to things that were they're personal, those are actions, those are values, and you talked about errors that you made. So I just want to thank you for your earnest reflections on that, and then I'll end that with a humorous comment that I'll tell you, I never did any white girl things, so
That's good,
that's all
Mike.
on you, not me. uh, Uh, with that said, I'm going to now shift the topic a little bit. Julie, uh, you did mention that you had several things that you wanted to talk about that were beliefs you no longer had held, so that you no longer hold. I'll give you space to circle back to that if you want. Let's rapid fire something real quick because you
Yeah.
just led me into this. As best I can, I'll create a 1 to 3 word statement, whatever comes to mind to you. You tell me whether you think that it holds merit or needs to be debunked, etc. And however you want to elaborate. We'll just, I mean, this is imaginative. We're playing along, beliefs and no beliefs. I'm going to start with one of, well, I won't bias you at all. I'm just going to say 2 words, and you tell me whether it now has greater or lesser belief in your mind and space in rehab compared to whatever time in the past. So I'm just going to say dual task. Run with that. Do you have belief in that or no belief in that? Did you used to have too much belief in it? Talk to me.
Ooh, good one. Yeah.
Yeah.
I think for a while I was obsessed with dual task, Mike.
Yeah. Yeah.
I'm over here dual tasking with my
Okay, there
fidget
you go.
as we
Yes,
speak.
you are.
I don't have my treadmill, so I can't walk on it while we're
Yeah.
speaking.
Yeah.
And I will say perhaps this has shifted a bit for me. Not a
Okay.
belief in it.
Yeah.
So I find dual tasks to be a really nice challenge for folks.
Yeah.
Um, I also find it incredibly engaging for my brain.
Yes.
And so this is the component that I think dual task has really grown for me, is really trying to I want to really I'm so curious about people's brains, Mike, but particularly a not a neurotypical brain, a brain
Yeah.
that might process things differently. So I think that my application and understanding of dual tasks that was really primed in working with people in Parkinson's and post-stroke, and I still work with those folks, and I still find it incredibly powerful way to progress a challenge. But I
Yeah.
think in the population I see more of now, which is folks with autism and ADHD and functional
Mm,
neurologic disorders and concussion and TBI, I think I'm thinking about it a lot differently
yes.
in how it actually might help them process information, how it helps
Hmm.
their sensory system. Um, I and I think, and again, I mean, this could be the like, let me praise Mike Studer show, but
Let's not. Mhm.
I think the shift to from like a dual task to a very salient task, whether that's a
Mhm.
dual task or actually just a crafted, novel, new, gamified task
Uh,
that helps elicit automatic movement for somebody that doesn't have that
right.
capability. That to me, so I think my belief hasn't necessarily changed. It's just a shift in focus to me.
Right. Wow, that's amazing. So, welcome to the reactive Instagram account where everything is a fun, engaging, playful, salient task that a patient is just chewing up and swallowing and wanting more, to the point that they don't even realize how much better they're doing because they're so engaged in the task. Right. Yeah, that's lovely. All right, let's add another one then. And you can just play with it wherever you want. Um, Intensity in training. How
Oh,
has that changed with you over years?
yeah. Boy, this has shifted a lot. And again, I think this is a population shift. You know,
Yeah.
because I where I trained, so again, I did internships and then residency at Rancho Los Amigos. We were doing NDT training, right? So my
Right.
CI and then my clinical instructors were NDT instructors. They were incredible. It was all about really optimized movement,
Yes.
not necessarily intensity, right? So this is
Right.
early on. I've been through so many pendulums of the physical therapy
Yes.
world, Mike. Like
Right.
I feel like
Yeah, because your intensity,
then,
you're going to tell me it went here and here and here, but talk to me.
yes,
Yeah.
yeah. So went from like optimized, really normal movement, and then we went to intensity. And I'm working on the LEAPS trial, and it was also trying to facilitate optimal movement at this
Yeah.
intense level.
Hmm.
Um, and voila, that wasn't really the miracle drug either.
Hmm.
And certainly high intensity gait training has really been all the rage. And you know what? This is stuff that we've done. We were part of Parkinson's studies at Reactive doing this on the bike as well. Our
Hmm.
patients with Parkinson's do excellent with high intensity anaerobic training. And then I started working with people with POTS and
Hmm.
people with post exertional malaise, right?
Right.
And any bit of intensity is going to wipe you out for a couple of weeks, right?
Wow.
And
If
so
not burn the patient on you, right?
yes,
Yeah, you might
absolutely.
lose them
And
entirely. Yeah.
so, oh, you would absolutely, because you just almost killed them. So,
Yeah.
um, different populations, different physiologic needs as well.
Hmm.
And
Hmm.
what I can see in the population with POTS, but also in a population with functional neurologic disorders and many other conditions, it's really actually about the the salience. I'm going to use that word again,
Yeah.
but
No, it's totally
we
fine.
don't even have to do 100 reps if we can find the thing that actually helps that person access a different pathway in their
Right.
brain. Now we might need some repetition and practice and doing it in different environments, but not at the level that we found that we might need in the person post stroke or with Parkinson's. So I would say you know, my mind has broadened quite a
Hmm.
bit
Yeah.
I think, come pretty, like, if the pendulum has, I've been through both ends of the pendulum swing, and I kind of feel like
Yeah.
I'm hanging out happily in the middle where I can actually go, well, this person, they actually want, who loves intensity? Me, Mike. I love intensity, right? Give me intensity. I want to run a marathon. Like, give me an intense discussion. Like, this is great, right? Like, we
Right.
can talk about
Yeah.
intensity on many different levels. I'm kind of an intense person. So
Right.
if you were going to, when I have a stroke, Mike, you know what I want? Like, get me running on the treadmill and I'm going to do this like
Yeah.
100 times a
Right.
day and all of these things. So it's just so person specific.
Wow.
Um,
Yeah. Amazing. So big picture now, I'm not going to give you another, let's say, lightning round here. Big picture, you've given us some huge talking points. You've talked to us about, even though you didn't use the words, addition through subtraction. One of the things you started off with today was relaying a patient who now feels that they no longer have the cloud of, am I crazy? No one believes me. And the addition through subtraction was, we're going to take that questioning of yourself away because we have now multiple practitioners, yourself, and you kind of referenced perhaps a physician that demonstrated belief in this individual. So early on in our talk today, you talked about addition through subtraction. Again, you didn't use those words, but I'm putting that in there. You additionally talked about from that the benefit of being believed, right? And in addition to that, you talked about the debunking the, let's just say, the pillars of what we knew was factual about rehabilitation, that this treatment is superior to that. And then since then, you've been sprinkling and peppering us with the fact that whether it's dual task or intense training or anything that we've talked about, there is no absolute in rehabilitation that this works for all people at all times. So the other big theme now that you've talked to us about is that many different treatments, interventions, and approaches of how I approach people verbally or manually or with a task or with intense therapeutic exercise, all of these things can have place and time. But we could make an error every single time if we misappropriate or mismatch an intervention with an individual. So we are giving space for more treatments than we used to. Uh, we are understanding that some things that we used to apply as this needs to be applied for everyone, including myself and what you actually said. And I didn't want to bias you in dual task. I used to think dual task was something I needed to do, even though I never stated this. I just naturally did that with every person, and intensity naturally with every person. And we find that we're missing the mark if we think that everyone can be covered with the same target.
right.
So that's you've brought us to that. So, Julie, now before we wrap up, I'm gonna take my top shirt, but only my top shirt off, because now I'm gonna match your effort today at wearing an intentional shirt. You know what I'm wearing, though. Now you know
Oh,
what I'm gonna pull off
I
here.
do I? Do
You
I, Mike?
do, because I'm gonna bring the camera down here a little bit. You gave me this shirt.
Yes.
Um,
I forgot about that shirt,
Yeah,
Mike.
how about that? So I found it in my closet today. I knew what I was
Oh my
searching
God.
for, and I know the color of this shirt so well. And then I had to find, because I've got all these shirts folded, and then I knew the feel. I was like, that's it. This is the one, because I couldn't see the logo, emblem, etc. So for those of you that are looking at this, Julie gave me this shirt
Amazing.
something in the neighborhood of 8 years or so ago. Neuropracticity is endorphinic. So crazy, because I coined that, and I probably should have said it's dopaminergic rather than endorphinic
Right.
now, and I just look at all the things anyway. So our friendship has evolved through different iterations of ourselves as well.
Yeah.
Julie, let's go back to the first question before we wrap up here, and let's just get a reset from the Julie Hershberg. What excites you about the future of rehabilitation now? And you can
Mm.
open this up to just what are you looking forward to and looking for now? And you've told us about belief and finding the individual. Is there anything that maybe is not on the radar of other people that you feel enamored about, that you think might have some promise? Who's sitting in single A baseball right now that you think might be an MVP in 3 years? Talk to us.
um Gosh, well, that pitcher on the Toronto Blue Jays
Oh,
was
yeah.
like sitting in the minors and
Trey,
ended up in the
Trey
World
Yesevic,
Series, right?
Savage, right, right.
Yes,
Yeah,
right.
yeah,
So I know we share this love of baseball, so that was such a
yeah,
good analogy, and that's all I could think of
yeah.
is well, and so there, I definitely have a current obsession, and I'm going to call this obsession,
Okay.
it's personal, it's patience, it's all of those things. And I don't really think it's in the minor leagues. I think it might be in the
Okay.
minor leagues of physical therapy, but it's been hanging out in occupational therapy and psychology for a long time, and that is
Yeah.
interoception.
Oh my
And
goodness. Talk to us. Yeah.
and I have to share, at least briefly, obsessed with this,
Yes.
from understanding my own self. I have a child with autism as well, where
Mhm.
interoception is a big piece of
Mhm.
what makes it hard to function in the world, or difficulty with interoception, right?
Mhm.
So
Mhm.
I'm just bringing that personal piece because that drives some of my curiosity. But then, of course, I see this in our clients as well. But I think one of the biggest pieces of this, and again, this wasn't even a word. I don't even know that I learned it in PT
Yeah.
school.
Mhm.
So I've come a very long way. But what excites me about this is that, as something that we can understand for a person who is really lacking a sense of self agency, interoception is the background, the backbone, I mean, of
Mhm.
really feeling like I own my body. I can
Mhm.
voluntarily control my body. I
Mhm.
can, like, uh, feel a ownership of a bodily self. Like, this is a fundamental
Right.
psychological need for all of us.
Right.
And
Mhm.
if we lack that for whatever reason, whether it's neurodevelopmental, maybe it's actually due to a brain injury or stroke, or
Mm.
due to a functional neurologic disorder, whatever it is, um, we we lack a real connection to our bodies, and it can really
Mhm.
cause a whole lot of symptoms, right? And so I think I am just beginning to peel the onion personally, and
Yeah.
how I
Mhm.
can bring this into physical therapy, how I can understand it for a person. And honestly, one of the cool things, and this is where I think people have to, like, personally pursue some of these things. part of that understanding is understanding it for yourself.
Yeah.
Just like as a runner, when I meet another runner, I'm like, oh yeah, like I know what I'm feeling, right? Like similar things to understanding this sensory part of our system of interoception.
Wow.
I think it starts with ourselves because we also know in that therapeutic relationship
Mm,
how when we sense our own heart rate rising and the effect on the person
mm,
in front of us, that's really powerful. Well, that's interoception, right? So
yeah.
so anyway, it's a personal and professional curiosity and obsession, and I think there's a lot more that physical therapy I'm learning from our occupational therapy and psychology
Mm.
colleagues in this world.
That's massive. I love that because, you know, that it really spans the gamut, doesn't it? Because you could have an individual with an unraveled perception of self, whether that be I don't know how I'm coming across, I don't know where my body parts are in space, I don't have confidence that I can control my body through this movement, all of that. And we talk about if we want to be localizationist and we want to be reductionist, which would be
Mhm.
unfair and oversimplified. We might say extra striate, body area, body schema, but it's more than that,
Right.
right?
Right.
And we think about the individuals that are developing normally as infants into toddlers and children. They're developing the sense of place in world and how their movements can affect other things. It's a normal development that can be missed by others. So we see one end of the spectrum in terms of lifespan that it's developing, but it doesn't mean that individuals that are masterful and highly skilled athletes, you're in Los Angeles, California, I mean, we could talk LeBron James, Kobe Bryant had been there, right? Magic Johnson would be an example of that. You're in the same state as
Shohei
Steph Curry.
Otani, come
Shohei,
on, Clayton
yeah, I mean,
Kershaw,
all the
like
things, right? And so and if you think about it, I think about it basketball even more than baseball, where like a Steph Curry knows where he is in the court, knows where other people are, how he's handling the ball, how far away he is, what the clock is reading, and all those things. And we know that even those individuals can lose their sense of how fatigued I am right now, how close I am to injury, because they may be so driven by something else that they blow right through that, hey, I'm not the best person to put on the free throw line for a technical right now because I don't have actually awareness of where I am. So people on all ends of all skill levels can truly be missing that. And that's a beautiful thing that you've elevated for us here in this forum. That's great. I love the fact that you picked that out and also said, hey, it doesn't live in the realm of physical therapy, but it's not in the minor leagues. It's just that we're not spotlighting it, right?
right, right.
Yeah.
I think
Wow,
I think we should move it up to the World Series for PT for sure.
I love that. Yeah, that's great. So Julie, we both brought shirts today. We brought the energy. We summarized some of the magical places that we went in this conversation. Julie, thank you for the time that you spent with me on this. I hope that viewers will find some value in our heartfelt thoughts and in our laughing and in our introspection and retrospection as well. This is not a highly produced, this will never be a podcast, so it will always have informality amongst the jewels, and you've brought some jewels today, jewels.
Thank you. What a definite pleasure. We could hang out and talk all the time. So it was just so nice to have
Yeah.
um 54 minutes so far with you, Mike. So
Yes.
thank you.
Yes, thank you. Well, I'll bid you good night, my sister in physical therapy. You take care and keep doing
Likewise.
great things. Thank you so much.
You as well. Thanks, Mike.
All right.